A lot of questions, obviously, with the Affordable Care Act now instituted. You can go to exchanges and get signed up. With us tonight, Luther Stueland with Blue Cross Blue Shield. Essentially, you basically interpret what the Affordable Care Act means for Blue Cross Blue Shield. Is that correct?
Yeah, a lot of my efforts have been around making sure that our products and our operations are ready to be compliant with our products, make sure that we can accept enrollment through the exchanges.
Okay, and then tomorrow you're kicking off a statewide tour, at least Blue Cross Blue Shield is, to go out to the people and explain, hey, this is what this means for individuals and families. Kicks off tomorrow in Grand Forks. I believe there's a session in the morning, also a session in the afternoon. But what's sort of your purpose and outcome with the statewide tour?
Well, long ago we realized that this was a complex law and that we needed to do our part to make sure that people were informed about how the changes in the ACA could affect them. And so about a year and a half ago we started talking to our employer groups, so employers that have purchased coverage through Blue Cross Blue Shield of North Dakota, and we began engaging them in what types of changes could be coming for them and what they need to consider when they're making their health benefit decisions. So we looked at that also for the individual market. For people that don't have coverage through their employers, we know that this is a complex law and they have questions, and so this is really geared around trying to clear up any misconceptions, help them understand what types of federal assistance they may be eligible for, what the individual mandate means, what types of coverage are going to be available.
And I want to get to some of those specifics, but obviously I'm sure you've got a lot of people in your ear. What's the biggest misconception or the most frequently asked question you guys are getting at Blue Cross Blue Shield?
Well, one of the more complex questions is about the federal assistance programs. There's a premium assistance program and a cost share reduction program, they're called, and we get a lot of questions about that. Sometimes we think in terms of what most people have. So most people have coverage through their employer, and they're largely not affected as directly by the Affordable Care Act. If we set aside fees and taxes and some of the requirements around what types of benefits need to be included. But for individuals, it becomes really more of a question about their income tax filing, what their household like, who has coverage through this program and who has coverage through that program. And so complex households become very difficult.
And I think the big question that people are talking about now is who's vetting that? I mean, I could go on there essentially as an individual and say, hey, I'm living below poverty, right, until they check my IRS things through 2014. I've heard that information is not being vetted, so anybody can go on and get these subsidies.
Well, the administration's decision to delay the employer mandate also included a delay in the reporting requirements that employers would have. So this kind of goes to, you know, do you have coverage? When people file their taxes for 2014, they'll be asked, did you have coverage in all the months of 2014? And so right now, the IRS is going to have to use their normal auditing process to determine whether or not people are being truthful when they file their income taxes.
So if I don't have it as of January 1st, 2014, what's my fine for 2014 and what does it ratchet up to eventually?
Right. It's a greater of test between $95 for an individual for each adult in the household up to 1% of their income. So it's a greater of one of those. In 2016, it gets to $695 for an adult, half of that for a child, or 2.5% of income. The penalty will never be more than the cost of the lowest bronze level product on the exchange. So you wouldn't ever pay more of a penalty than you would pay for health insurance coverage.
And they just pull that right out of your tax refund, or where do they get the $695? If I were to have to pay that fine, where does it come from?
Exactly. It becomes a reconciliation between you and the IRS. So if you normally had only owed, say, $1,000 and you didn't have coverage, this would be added to that.
Walk us through if you can, because we tried to go on the federal exchange last week and get signed up. We couldn't do it. As you know, many people aren't able to do it as of right now. But we keep hearing about the platinum, the gold, I think it's silver and bronze. Mm-hmm. What do these different plans mean for individuals and families?
The metallic levels, as we call them, the bronze, silver, gold, and platinum, refer to what's called actuarial value. And what it is the way that actuaries determine the value of a product. So how much is the health insurance company paying versus what the member is paying when they pay their deductibles, their co-pays, and their co-insurances. And so a 60% bronze plan means that the health insurance company is paying 60% of claims cost on average, and the member is paying about 40%. But again, it's an average, so you're going to have people who see more value and people who see less value than that 60% number.
So at the end of the year, let's say I go to the doctor between my pharmaceuticals, operations, whatever, I've got a total healthcare bill of, let's just say, $10,000 to make it easy. What you're saying is that under this bronze plan, that plan would pay for $6,000, I would pay for $4,000?
On average. And so
Yeah.
it really determines, and I don't know exactly where the average will fall, at what dollar figure, and it would vary from plan to plan. But on average, that's the value that you're going to
And
get.
then so
from
the
that
platinum
product.
would be what, a 90-10 or?
Correct, 90% actuarial value for platinum products.
So what's the difference in pay? If I go and sign up for the bronze, how much am I paying per month versus the platinum?
Well, I can only speak for Blue Cross Blue Shield of North Dakota. Because we're a nonprofit organization, we do our best to charge a premium that's appropriate enough to pay our claims and make sure that we have reserves to pay claims. And so we've done our best to say, yes, this is a 90% plan, and this is the premium that we need to recover the cost of the claims that we expect to receive.
So give me kind of just, and I know that's a tough question, but just sort of a ballpark. If I'm a young person or maybe even older person, maybe I've got a pre-existing condition, I sign up for the bronze, I'm going to pay what, $200 a month, and the premium would, or excuse me, the platinum would be $500 a month, or?
I don't have the figures with me or right off the top of my head. I think our bronze products start below $200. Again, it depends on your age, and so under the ACA, the rating between the youngest individual and the oldest individual can vary based on a 3-to-1 factor, and so it kind of depends on your age. Pre-existing conditions will not weigh into the cost of your health insurance coverage.
So anything else you should share? I mean, anything else that we should know that maybe I'm not asking you?
Well, that's a good question. There's a lot in the ACA, and I would just urge people to do what they can to read up on provisions that affect them directly. If they don't have coverage through their employer, actually, let me back up. If they have coverage through their employer, and most people in North Dakota that have coverage get it through their employer, they're largely not affected. If they want to go to the exchange and see if they can get a better deal, they can look at that, but one of the requirements to gain that federal assistance is that you can't have been offered affordable coverage through your employer. So once you have, that sort of prevents you from getting those federal assistance programs.
Thank you. It's so much to chew on. We only had 5 to 7 minutes here, but at least it'll give people a taste of what's out there, what they can be doing. And again, North Dakota right now is using the Federal Health Exchange, where Minnesota's got MNsure, which is a state-operated exchange, correct?
Yeah, that's correct. And in large part, they're not much different. The eligibility requirements are the same. They may operate theirs differently, and their website looks differently. They have some federal dollars that they can use to advertise. But the federal exchange, the guts of it is generally the same, and the requirements under it.
If I go to the federal exchange, is there anybody else I can get service through other than Blue Cross Blue Shield?
Yeah, there's actually 3 carriers that are offering products on the health insurance marketplace this first year.
All right, thanks, Luther. I appreciate your time and the info.
Thanks for
We
having
will be diving into this, obviously, a lot more. Such an important topic, your health care. Stay with us. Much more coming up on 630 Point of View. As always, be sure and join our conversation. Head over to our website, 630pov.com.